Anxiety and Panic Attack, Chapter I. Anxiety is a natural response to stress or a perceived threat. It is a feeling of unease, such as fear, worry, or apprehension, typically about an upcoming event or an uncertain outcome. While anxiety is a common human experience and can be a normal part of life, it becomes a problem when it becomes excessive, persistent, and interferes with daily functioning. Panic attacks, on the other hand, are intense episodes of sudden and overwhelming fear or discomfort that reach a peak within minutes. During a panic attack, individuals may experience a combination of physical and psychological symptoms, including a rapid heart rate, shortness of breath, chest pain, trembling or shaking, dizziness, sweating, feelings of impending doom or losing control, and a sense of detachment from reality. Panic attacks can be unexpected, occurring out of the blue, or they may be triggered by specific situations or phobias. They can be extremely distressing and disruptive, often leading individuals to fear future attacks and make changes to their daily routines or behaviors in an attempt to avoid them. Panic disorder is a mental health condition characterized by recurrent and unexpected panic attacks, often accompanied by persistent worry about experiencing future attacks. As contemporary humans, we are forced to deal with a life filled with social, financial, and work-related stress. The average person's lifestyle has undergone a significant change in the last 100 years. We are going through a great deal more stress coming from sources that simply did not exist 100 years ago. The issue is that our physical makeup hasn't had enough time to adapt to these social stresses and change in order to function effectively and stay healthy in such circumstances. When circumstances arise that raise the amount of the hormone adrenaline in our blood, anxiety levels rise. In order to get the body ready for what is known as the flight or fight response, adrenaline is released. It is essential for survival that this process has developed in order to get the body ready for action when faced with danger. Some people can handle this increased arousal, while others actively seek it out by engaging in risky activities like bungee jumping or parachuting, but they appear to have higher than average levels of both benchmark anxiety and adrenaline. The fear of experiencing a panic attack frequently leads to the development of panic disorders. In an almost vicious cycle, the disorder worsens as a result of the sufferer using avoidance strategies to manage situations that make them anxious. As our anxiety levels increase, our subconscious mind changes how it processes normal to fit our behavior. Repeatedly experiencing anxious symptoms, including panic attacks, leads the brain to believe that doing so is completely normal. Habitual behavior is subsequently formed. The 5 disorders of anxiety. There are 5 different types of anxiety disorders, but I detest the word disorder because it implies illness, whereas anxiety is merely a malfunction of the normal bodily process. 1, 2, or all 3 of these conditions might be present at once. The 5 disorders are as follows. Generalized anxiety disorder. Anxiety or panic disorders. Phobias. Post-traumatic stress disorder, PTSD. Obsessive-compulsive disorder, OCD. Thank you for watching. If you like this video, please subscribe and hit the like button.